Hello, everyone. Dr. Hassan Tohid here once again, live with a sensational session. Let me fix the camera, make sure that everything is perfectly fine. Yeah, I think that's good. That's good. You guys can see me, you guys can hear me, and I think this is perfect. Now, let me share the link with everyone, and I want to make sure that every student who wanted to attend is present here. Okay, just give me a couple of minutes, and anyone who is watching me for the first time, please make sure you subscribe to this channel. Click subscribe. Click on the subscribe button and the bell icon button so that you are aware of whenever I am online. Okay, so I think we are all set, and let's begin. And please do comment when you are here. Do comment. This is a live question answer session as well, and I'll answer your questions and concerns as well. And for past few weeks, I had a tough time and I could not do the classes. I apologize for that. And first, what happened? I was not physically fit. I was a little sick. Then when I went better, when I became better, then other issues came over because when I was sick, I was not doing certain things that I was supposed to do. Then a lot of workload came, and that's why I was really occupied. So I'm glad that now I'm back and we can do the session peacefully with nothing on my mind. Actually, there is something on my mind. I have a meeting at 12. I have a meeting at 12, so I have 90 minutes with you guys, and I'll try my best to make sure I answer any questions or concerns, and I help you guys with research, and we discuss the difficulties and challenges that anyone faces in research. Okay, so we'll talk about this. And first of all, remember, best of luck for your next week. Only 5 days left in residency applications. Pray for your success and just do it. I know you can match. Anyone can match. Just remember, you need to practice more and more. You need to practice interviews, and if you want, we can do a live session, an interview session. Although I have done it before, but I can do it live again for anyone who is applying for a residency application, for residency. Anyone who's applying for the clinical residency. Okay, so we have Virender, we have Sandura, we have Mira, Robani, and Sania. Thank you. No. My session, my live question session, my live question answer session, I shared a video with you guys. I shared a video with you guys that explained what to expect in this course. And in that video, I explained what to do. So my live sessions will be on YouTube link. My live sessions will be on YouTube link, and your live classes with your mentor will be on Zoom. I deliberately don't want to do Zoom because then I have to send the recordings to all the group. Here, I don't have to send the recording. It is automatically recorded. So that becomes easier for everyone. Okay, so guys, you are most welcome to ask any questions. Anyone has any questions before we proceed? I will answer your questions. And by the way, everyone, there are some changes in the system now. And for first of all, let me explain to all the new admissions what to expect. Okay, so this is very important. This is very important. And are you guys ready with your questions and concerns? Okay, so you will have one live class every weekend, every Saturday or Sunday, depending upon the schedule. You will have live sessions with me every week, and I try my best to come every week. Although it was supposed to be on Tuesday, but because of my availability these days, it's not always Tuesday, but I try my best to do that during the week anytime. but I'll let you know when exactly is my session. So live question answer session with me, live question answers, live session with your mentor, and also you guys will schedule live student discussion sessions for all those students who are planning to co-author with each other. You guys should meet with each other so that you can justify the co-authorship. Without justifying the co-authorship, you cannot co-author with your classmates. That's why the live question answer sessions are very important. And make sure you record your live question answer session where you are helping, giving suggestions to each other. The guidelines are available on your account. When you log into your account, you have this guidelines available. And by the way, guys, now we are on app. The advanced research videos that you watch, the recorded material, besides the live classes, you can watch on the app. And I'll give you the guidelines how to do that. Okay, so now listen to me, Sania. You have questions and concerns, right? Okay, so remember, this is live course, right? You have live classes, but we have given you some recorded classes, some recorded videos of the same course that you will watch. Now we have an app system. You can use app, and I'll give you the details how to get uh, download the app and use that app, and you can watch those videos on the cell phone on your app. Okay, and secondly, you not only just watch the videos related to be a published author program, but we have given you some gift courses, career related gift courses, and that was a surprise from me. I did not want to mention that before, but I'm telling you now for all the new admissions that you have those gift courses, so certificate courses. Complete them and you will enjoy the fruits, and you will really love it. That's my promise. Make sense? Everyone is clear about this? So you have your live classes with your teacher, with your mentor. You have live question answer sessions with me. You have live student discussion sessions with each other. And your mentor will decide the student in charge, and you will do that. And you guys also will watch the videos, advanced research videos on your account, and that you can watch now on the app. Okay? And you you also have bonus courses from us, some gift courses. I wanted to give you some gift courses that usually people charge a lot of money for those courses, and they are expensive courses. But I've given you as a gift because I wanted you to learn more and get more certificates on your CV and get more courses and learn more. So that's the gift from us, and in which you have different courses like CV, writing, personal statement, many other different courses that you will really enjoy. Okay, so now this is how you study for this course, and make sure you attend the class, and make sure you keep asking questions on WhatsApp with me and your mentor. So if you don't ask questions, you don't learn enough, I'm telling you. Okay, and today we are talking about the challenges in research, in completing research. The biggest challenge is the mental challenge, the mental block. Many people have this block that, oh, I cannot complete my paper, I cannot be a published author. Finish that mindset. First of all, change that mindset. Start saying out loud that yes, I can write a paper, I can be a published author, I can do it, I can do it, I can do it. First of all, do this exercise every day. Say it aloud so many times that you start to believe that yes, you can do it. Initially it is difficult. When I started doing this exercise with myself, related to my career, initially when I had no achievements, my mind used to know you can do it, but I used to fool my mind by repeating it again and again and again. And I'm insisting all of you to do this exercise. It will change your life. Say it out loud. I can do it, I can match, I can do it, I can match, I can be successful in my career, I can be successful in my life. Yes, I can. If other people can do it, I can. Better than you, nobody is better than you. If other people have done it, you can do it. Okay, so now let's talk about this, the questions. Remember one more thing I have always mentioned, and I will mention it again. Take absolute responsibility of your career, take absolute responsibility of your life, take absolute responsibility of your paper. Remember, there is no Superman coming to help you and rescue you. There is no Superman coming to help and rescue you. You have to do everything on your own. Only you can change your life. Remember, when we all were kids, somebody was taking care of ourselves, right? Somebody was taking care of us, like our parents, our siblings. So we learned this lesson of help. This is a learned helplessness. We felt that whenever we are in some kind of need, somebody will come and rescue us, somebody will come and help us. In reality, guys, this does not happen. Life does not work this way. There is no Superman coming. Now you are adult, it's your responsibility. Now it's your time to help others. Nobody is going to come and help you. I have a bad news for you. Nobody is coming to help you. No Superman is coming. No mumbo jumbo or whatever you call it. No divine angel is coming to help you out. You are going to help your own self. That's why nature has given you these hands, this mind, these eyes, and the capacity to plan and think. This is the reward of the nature that nature has given to you, because there is no Superman coming. You have to do it on your own. Nobody is going to give you residency, only you have to work for it. Nobody is going to help you pass your exam, only you have to help yourself. Nobody is going to complete your paper, only you have to help yourself. Nobody is going to get your paper published, only you have to do it yourself. If you take absolute responsibility, you will be successful. The percentage, I would say that, be so responsible, be so responsible in your life that nobody has ever been. Remember, the somebody I was asked this question twice this month by two different students, that what are my chances of getting this paper published. My answer is always the same. It depends on the level of responsibility that you take. If you are 100% responsible in your life and career, the chances of your publication are 100%. If you are 90% responsible, the chances of your publication 90%, which is a huge percentage, but still there's a 10% chance of failure. Why can't you take absolute responsibility of your life? Why can't you take absolute responsibility of your life? Sanya, please listen to me. This is very important. I'll answer all the questions. First, I want you to grasp the lesson of responsibility. Take responsibility of your life. Only you can change your life. Nobody else will change it for you. This is one lesson. If anyone grasps this lesson, he will be the healthiest person mentally ever. In fact, an expert, Brian Tracy, he once said that if everyone takes responsibility and becomes extremely responsible in their lives, the psychiatrists and psychologists will go out of business. That's so true. We tend to get depressed and we develop anxiety when we learn not to take responsibility. You are responsible for your life. If you are not happy with what is happening in your life, you are responsible. If you are not satisfied with what is happening in your life, you are responsible. If you haven't achieved what you wanted to achieve in your life, then you are responsible. If your life is not giving to you is if your life is not giving to you what you wanted, that means you are responsible. That means you have to change what you're giving to your life. Life does not give us what we like or what we want. This is very important. Remember, life does not give us what we like or what we want. Life always, almost always gives us what we deserve. Be deserving. How does that happen? By developing the sense of responsibility, that I am responsible and I'm not going to blame anyone for my failures. The difference between a responsible and irresponsible person is irresponsible person always blames others. Successful people always take responsibility. Have you ever heard a self made failure story? You always hear self-made success stories. Why don't you hear self-made failure stories? Because they blame others. Failures always blame others. They never learn to take responsibility. How does that happen that with the same course, same training, same CIBNP, some people turn out to be extremely successful and we get publications almost every day? We keep hearing news about our students' publications. They become successful in their life and career. And at the same time, some students, they don't complete their paper, they don't become published author. And those who don't, they blame us. They blame the teacher, they blame somebody else, they blame their classmates. They will have all the list of people to blame. One of my students, I would say our students at CIBNP, she had a problem with a mentor, with the teacher. So I changed her group. She said, "Oh, I'm not able to complete my paper because my mentor is not good." I gave her another mentor. She did not do it. She still did not complete the paper. I said, "Now what's the excuse?" Now she doesn't reply to my messages. Who is responsible? Guys, we have given you everything that can help you become successful in this program. Live classes, live sessions with me, live classes with your mentor, recordings of each session, live student discussion sessions, recorded material, lecture notes on your account, ebooks, exercise book, everything has been given to you. If you don't utilize it, if you are not successful, despite all of these things, then who is responsible? We are continuously in touch with you on WhatsApp, on phone calls. Yet, if you don't become successful, then who is responsible? Don't blame us, blame yourself. If you learn to blame your own self, take responsibility that, yes, I'm responsible, your life will change. Your future will change. Everything will change. I was an irresponsible person, guys. I was a very irresponsible person. I was not performing well in my school. I was not doing well in my career, in my life. And I used to blame others. But then I learned the lesson of responsibility. And today, here I am. Just by learning the lesson of responsibility, I took absolute responsibility. Anything that is happening around me in my life, career, finance, spirituality, anything you name it, I'm responsible. So I take care of it. I control my life. I control my destiny. So I want all of you to be that responsible. Take responsibility of your paper. Don't blame anyone. Take absolute responsibility of your paper and say, yes, I'm responsible. I have to finish this paper. So now we have a question here. Item 21 of the Prisma talks about reporting bias. Can you explain how we approach that aspect of Prisma? Reporting bias will be the quality appraisal tool, right? If you just mentioned that we used this XYZ quality appraisal tool to check the quality of the studies, and we kept the studies with higher score, and the studies that had bias, we removed them. We took them away. We put them away. That's all they want. Okay, now Sania, how to initiate it? The video you shared about cohort was totally understandable, but when it comes to write a protocol paper, it gets difficult and different. The training has not started, Sania. The training has not yet started. Your training has not yet started. Your classes will begin this weekend. Your live classes with your mentor will begin this weekend. I just shared some extra video with you guys so that you can enjoy and learn, but your classes have not begun. Your live classes will be this weekend, either tomorrow or Sunday, from scratch. And you need to understand what is a protocol, what is a research article, what is a review article. You need to understand these things. You will learn all of this thing in the training. Tomorrow is the first session for the new batch, and you will learn how to select a topic, how to decide a topic for your paper. Does it make sense now? Any confusion? Anyone has any concerns, any confusion? So now there's another question I can see. Do we have the list? Do we have to list the bias of each study we take as reference in the results section of our paper? Yes. What appraisal tool did you used? Okay, so all of those things. Give me a second. Okay. So now the main challenge is the mental block, and we have taken care of it. Now you will take absolute responsibility. Remember, if you are not happy with your health, that means you have been irresponsible with your health. If you are struggling to gain weight or you're struggling to lose weight, you are responsible. If you are not happy with your relationships, you are responsible. Take responsibility. That means you have not studied how relationships are done, how relationships are made, how to be happy in relationships, how to be a good sibling, or how to be a good husband, how to be a good wife. You have not studied this. This is a subject to study. People want to become doctors, so they study 5 years, 6 years, and 7 years, and then they become doctor, then they see patients. But when it comes to getting married, they never study how to be a husband, how to be a wife. There are plenty of books available. Did you ever read it? So learn to develop a habit of responsibility in every aspect of your life, and your career will flourish as well. Everything will be given to you by nature if you take responsibility. Okay, now Joanne has a question. Is it bad idea to do a systematic review only including randomized controlled trials I do not want to become if I do not want it to become a meta-analysis? No, you can still do a systematic review only of clinical trials, and you can still avoid it from becoming a meta-analysis by making sure that the clinical trials are different. Sometimes they're talking about a different outcome, sometimes they're talking about a different dose, different patient, sometimes they're talking about a different drug. So yes, if they are heterogeneous studies, then it will remain a systematic review. How do we ensure heterogeneous studies at the stage of data collection? To be very honest, majority of the studies, when you include so many studies, most of them are heterogeneous. Most of them are heterogeneous. And if you have two plus studies, similar studies, two and more similar studies, then it is going to go into a meta-analysis. It is going to go into a meta-analysis, I'm telling you. So you have to be careful. You have to be careful. Okay, so ideally the best is that you write a systematic review of combined studies, combined study designs, clinical trial, and some kind of observational study, cohort or cross-sectional or um, case control. Heterogeneous studies could be if the patient is different, if the intervention is different, if the outcome is different, if the control group is different, and try to include non-randomized control trial, no control group, no control group. Okay, so now everyone is clear about the responsibility. That's the first lesson of research writing and completing the paper, taking absolute responsibility and setting a deadline. Set a deadline that in 7 weeks I will complete my paper starting today. So all the new admissions, Sunny, I'm talking to you now. You're starting tomorrow, so set a deadline from tomorrow to 7 weeks that you will complete your paper in 7 weeks. Tomorrow, you guys will learn about the topic selection, how to select a topic. How do you actually start? You want to write a systematic review or a traditional review, but how do you select a topic? We have discussed that in my sections as well, but I'm just giving you a brief idea that on your account, when you create an account, I'll get back to you on your group and we will do that. There's a lesson 28. You watch that video as well along with your mentors classes on topic selection, and then you will be able to get an idea about topic selection. So once you have topic selection done, you are all set. Then you start collecting data, and then once you have collected data, now the writing begins. Now you have two options, whether to write a systematic review or a traditional review. Guys, if you are in a hurry, you don't have time, go with a traditional review. But if you do have time, go with a systematic review. And and if you have an exam coming up, then write a traditional review. But learn to write both. Learn to do both, and you will do this in this training. You will learn to write a traditional review, systematic review, scoping review, mapping review, all kinds of reviews in this program. You will learn to do that. But if you are in a hurry, go with a traditional review. I'll repeat again. And if you have an exam coming up, write a traditional review. But later, next project, you can start working on a systematic review right away. Don't stop. Don't stop after the classes end. Thank you, Varinder. Thank you. Okay, so we have a question from Doreen. Is the advanced mesh search used for both systematic? No, just for systematic review. For traditional review, you don't need that complication, that problem. Although it can make your traditional review easier to find data, but if you ask me, if I were to do a traditional review, I would not focus on mesh. Mesh actually gives you the best papers on PubMed. It depends, sometimes it depends on my mood. Sometimes I will, maybe I'll do the mesh strategy. So it's optional for traditional review. For systematic review, yes, go for it. Systematic review is very systematic. Everything has to be there. And regarding the protocol, there was a question about protocol somebody mentioned. Remember, writing a protocol is actually, what is a protocol? Protocol is your plan of writing a paper. Research protocol is your plan of writing a review article, and that protocol is submitted to a website like Prospero to give other people an idea that, okay, I'm working on this paper, so stay away from this paper. That's all it is. That's all it is. So if you are planning to register to a Prospero website or some kind of similar website, if you want to register your topic, then you write protocol. But I am again telling you this is optional. For this course, this is optional. You don't need to worry about writing a protocol. You just need to understand what protocol is, and protocol is extremely easy, guys. When you are done with your topic selection, you are done with your data collection, search strategy is done. Now you write your protocol, a quick protocol, and you submit it to Prospero website, and the other document will be your main paper. I'm not a supporter of I'm not a supporter of reporting or registering your paper to a website like Prospero. And I have my own reasons to do that, to not support it, because I believe it is not doing service. In fact, it is doing disservice. For example, if I register my protocol about a study, let's say I'm writing a study on Parkinson's disease and skin problems. Now I'm writing a study and I have submitted that paper, that protocol to Prospero website to let other people know that, okay, Dr. Hassan Tohid is working on this paper. So other people will stay away from it, right? But tomorrow, if I die, everyone else will think that, okay, he's working on it and nobody knows I died. Nobody else will work on that paper. Or let's say if I don't die, let's say stay a little positive. Let's say if I just change my mind and I don't work on that paper anymore and I forget to inform Prospero, so my paper will still be there and other people will stop working on this kind of topic. They will think that I'm working on it. And this can actually do a disservice. So that's why I'm against the protocol registration. Protocol registration of your paper, your topic is done to let other scientists around the world know that please stay away from it. I'm working on this paper. That's what protocol is. And before writing a systematic review, that's why many authors go to Prospero website and check if my topic is already being done by somebody else. If somebody else is working on it, they don't work on that paper. I'm not a supporter of this. I have a different ideology. I believe that it doesn't matter. I believe it doesn't matter if you're working on a new paper or a topic or an old topic. It doesn't matter. Write a paper. Give me a second. Okay, give me a second. Sorry, guys. Sorry. Okay, I got my tea. Nice tea. Okay, so now we understand the point. Now you understand the point that you don't have to register. Sunny, I have a question. Do you know what is a protocol? Let's talk about from the very basic, from the very beginning. I understand these are the concerns. Sunny, I'm talking to you. I saw you have a lot of questions and concerns, and this is pretty valid. You have pretty valid questions. So I'm here to answer those questions. Before your live classes begin tomorrow, I want to make sure that I answer these concerns and we make the concept clear. Okay, so Sania, now remember, I'm talking to Sania for now, and this will help everyone. Okay, then I'll answer and address all of you. When you are writing a review article, a systematic review or meta-analysis mainly, or a clinical trial, let's say any study, you actually register your topic on websites such as Prospero, and for clinical trials, we have other websites like clinicaltrial.gov. To let other people know that I'm working on this paper, please stay away from my topic. That's a nice way of saying, get lost. Don't touch my topic. I'm working on this paper. So that's why people register. But in systematic reviews and meta-analysis, it's optional. Write it down, Sania. Everyone, please write it down. Registration of systematic reviews and meta-analysis on Prospero website, Prospero, Prospero website is optional. So you write a protocol and you register to Prospero your topic and your protocol that, okay, I'm working on this paper. This will be my search strategy. This will be my keywords, everything. It's optional. But for clinical trials, it's not optional. Please write it down. For clinical trials, it's not optional. It's mandatory. Does it make sense now? Everyone is clear? Okay, so when you register, your work began. So it's optional whether you want to do it, whether you don't want to do it. Now the next step is the stage 1 of your systematic review. If you're writing a systematic review, your systematic review has 3 stages or 3 phases. 3 stages or 3 phases. Write it down. The first phase is the first stage or the first phase is the planning phase. Second stage or second phase is the search strategy. The data search, the real search begins in phase 2. The third phase is the writing phase. Let me add one more thing. If it's a meta-analysis, then the third phase is the meta-analysis, statistical data analysis, and then the fourth phase is the writing. It's so simple. So now, in the planning phase, stage 1, I think my internet is unstable. It says my internet is unstable. Can you guys hear me properly? Everyone can hear me? Yeah, I'm coming to that. I'll repeat again. Take notes. This is very important. Everyone can hear me? Please say yes, we can hear you. Okay, because I was just told by YouTube that my internet is unstable. Okay, so Now, phase one is the planning phase. Phase two is the search strategy phase. Phase three is the writing phase for a systematic review. The actual writing began. In the phase one, you decide. Now we are talking about phase one. Everyone, take a heading. No, fourth phase, if it's a meta analysis, then you have four phases. If it's a meta analysis, Sania, then it's four phases. And this training is for systematic review, not for meta analysis. So don't worry about it. Meta analysis has four phases, systematic review has three phases. Phase one, planning phase one, planning phase for meta analysis, two. Systematic review, phase one, planning phase, meta analysis, phase one, planning phase. Phase two, search strategy phase. Phase two, search strategy phase in both. Phase three in meta systematic review is writing phase, but phase three here is meta analysis phase. Phase four here is writing phase. Is this clear now? So in the planning phase, we're talking about the phase one. Phase one, either for systematic review or meta-analysis, is always the same. Decide your research topic and come up with a research question. Now, we discussed last time in my last sitting, the research question. Remember, research questions are of different types. Research questions are of different types. We will discuss that. We'll discuss that. Don't worry about it. But the first thing first is remember the topic selection. First, you need to decide exactly what you are writing. Okay, now add one more study. So we talk about systematic review. We talked about meta-analysis. Let's talk about the traditional review. In traditional review, you have two phases, I would say: planning and data collection and writing. Maybe the same three phases: planning, search strategy. But actually, there is no search strategy. It's just direct searching, data search. So because the traditional review data search, the search strategy is very simple and easy. So that's why I said two phases. Planning and data search is together and then writing. Planning and data search is together and then writing in traditional review. In systematic review, we have three phases. In meta-analysis, we have four phases. Is that clear? Everyone is clear about this? They all are review articles. They all are review articles. What is a review article? A review article is a study design where you combine previously published papers and you write one paper out of it. Listen to me again. In a review article, you combine so many papers together and you write one paper out of it. You write one paper by combining previously published papers, like combining 40, 50 papers on one topic and write one paper. That's a review article. Systematic review, meta-analysis, traditional review, scoping review, mapping review, any of those reviews, whatever it is, you will combine previously published papers and write one paper out of it. Now, how many papers minimum? This is one of the most commonly asked questions. That how many papers should I include to write a review article? Who will answer this question? Minimum and maximum. I have discussed that before, but I'm asking you guys now. What do you think should be the minimum number of articles included in your paper, and what is the maximum number of articles you should include to write one paper? Very good, Doreen. 25 minimum, maximum 100. For our standards at CIBNP, minimum 25 papers on one topic to write a paper, and maximum go up to 100. Although universally, systematic reviews can be written just by 5 studies. But I am here to let you guys know that The CIBNP standard is 25 and 100. So you will combine previously published papers, write one paper out of it. How easy it is, guys. It's a blessing. Writing an essay, for example, if you are sitting in an examination hall and somebody gives you a topic in the exam, a surprise question comes, my last day at school, or please write a good essay on the most memorable day of my life, or the responsibilities of a good citizen. Aren't these the most common essays that are usually written in the English language exam, isn't it? So if you get a surprise, now Virinder, I have a question to you. Listen to me and answer this question. If you have an exam today, for example, you go to an examination hall, you have an English exam, and the question sheet comes in, and you read the question, write an essay on my first day at school, and you were not prepared. So where will you get the data from to write that essay? Where is the data, guys? If you have a surprise test of an essay, where is the data? How will you write an essay? How did you write it? Let's say you have been given a surprise topic to write an essay. How do you write that essay? Anyone? Anyone willing to answer? Sania, you got the answer. Memory, previous knowledge or story. Exactly. So the data was in your mind. The data was in your mind. And you guys have done it before. Did that ever happen that you went to a test or examination hall and you were taken by a surprise? I had dealt with it. I was not prepared for the topic that was given to me in my exams. When I was in ninth grade, when I was in 10th grade, both years, I was not expecting that topic to be my essay. And when I saw that essay, that write an essay on this, I immediately went to my memory. I recollected everything and I wrote it down from my brain, from my mind. So the data was here. So, guys, what I'm saying here is essay writing is way more difficult, and you guys have done it before. Essay writing is way more difficult because the data was here in your mind, it was not in front of you. But in systematic reviews and in traditional reviews and in meta analysis, the data is in front of you. So, research writing is easier than essay writing. When you have data on your computer in front of you, you are taking an exam, so you are like cheating. It's so easy. does does it make sense? Do I make sense, guys? Am I able to explain the point? Like, research paper writing is like cheating in an exam when you're taking an essay, because the notes are with you. You have the notes. Yeah, that's a very good question. How about plagiarism? Why would you copy paste it? You don't copy paste it. Copy pasting is an academic crime, is an academic fraud. Don't copy paste, just rewrite in your own words. Can't you rewrite in your own words? Like, for example, you asked me this question, how about plagiarism? Now I have to say the same thing in my own words. How do we avoid plagiarism? How can we prevent plagiarism? Same line, I can say it in different words. How can we prevent plagiarism? How can we avoid plagiarism? Is there a way to prevent plagiarism? Is there a way to protect my paper from plagiarism? Is there a way to learn not to do plagiarism? Is there a way not to plagiarize? Same line I have said in different lines, different words, different sentences. So Virender, you got it now. Now you feel so confident that how easy paper writing is. You have a let's say you have a cheating material right next to you. Let's say you are taking an exam and you have uh, some notes with you to write an essay. That's what a research article is. You are writing an essay which is more specific. Essay is a little broad, but this research question will be a little specific. That's it. And you have the notes in front of you to copy from, to get information from. But every time you get information from other people's papers, you give them a reference, give a citation, and you write in your own words. Yes, rephrasing and paraphrasing. Very good. Rephrasing and paraphrasing. We all can do it. Guys, becoming a doctor is way more difficult than writing a paper. In fact, I can bet on this. Reading an ECG is easier than writing a research article. If you ask me to read an ECG, try to explain all kinds of problems in ECG, AFib, ventricular tachycardia. I don't even know the names. Cardiology is my weak subject. Always been. Hate it. Dislike cardiology. Never perform well in cardiology. So for me, reading an ECG is difficult than writing a paper. But to become a doctor in our final years, guys, in my final years, it was mandatory to read ECG. There was one examination center I remember in the OSCE exam. We had one section where there was a professor sitting, and our goal was to go and read the ECGs that he had. Otherwise, if you don't do it, you fail. And if you fail one spot, you are gone. You were not supposed to fail any spot. Like the way OSCE used to be, we had like 10 different corners, 10 professors sitting in 10 different corners. It was a one big hall, 10 different professors sitting in 10 different corners in an artificially created room. That was a tent because the university did not want to give us different rooms. So they gave us one auditorium for the exam, and we had 10 professors sitting, five on this side, five on this side. So I went to my first one, that is a medical exam, medicine OSCE. Went to the first one. The first one was like, he was sitting with a patient, and the patient had rheumatoid arthritis. So I recognized rheumatoid arthritis, and then all the questions were about rheumatoid arthritis. The second one was something else, maybe GI patient. Yeah, actually, I remember. There was a ascites patient, because of liver failure. So, and that was a real patient, by the way. So I answered those questions, and that went really well. Now I went to the third one, that was the ECG, and that was my weak point. But because that was my weak point, I learned and learned and learned with my friends, with my classmates. Everyone taught me this, that please don't mess it up. This is AFib. This is myocardial infarction. This is chronic myocardial infarction. This is a surgery, somebody who had previous problem in heart. This is the ECG. So I practice ECG. And when I went to that section with that professor, he had like maybe 10 ECGs, and I was supposed to recognize each of those. And you were supposed to recognize 6 out of 10 to pass. So I successfully did it. But if you ask me today, I can't do it. I don't remember anything. But at that time, I practiced enough. So what I'm saying is, the purpose of telling you this story is that I used to dislike ECG. I used to hate ECG. I never liked ECG. But it was mandatory to become a doctor to learn ECG. So I had to do it. So whether you like it or not, sometimes there are things you have to do. Same thing with research article, that in order to get residency or training program in the UK, now you are supposed to have publications. Whether you like it or not, you have to do it. But the good news is you all can do it. And second good news is it is easier than reading ECG. I'm telling you with experience. First degree heart block, second degree heart block, third. You remember those guys? First degree. If you give it to me today, I can't do it. Forgot, totally forgot. But research writing, I never forget because it's easier than reading ECG. So now Virender has a question. My way is to read the paragraph first, understand it, then close or hide the resource and write it down. Write it from your mind and understand it. This is exactly how we do it, Virender. Very good. This is exactly how we avoid plagiarism. Now I think you guys are pretty clear and you know this. So the phase one is the topic selection. Once you decide topic selection, then you decide the research question. Now, what kind of research question? If it's a therapy-based research question, you will need to rely on clinical trials. If it's a harm study or if it's a risk factor related, then you will have cohort studies or case control studies included in your paper. So what kind of research question you have will actually help you decide what kind of studies you will keep. But now another question, can you have a research question where you can have mixed kind of studies? Yes, there's a mixed design as well. Systematic reviews nowadays are also written with mixed study design, that you can have a clinical trial, you can have a cohort study, you can also have five cross-sectional studies, six clinical trials, and three cohort studies, prospective, five cross-sectional, five case control, and collectively you have written a paper. This kind of paper can never become a meta-analysis because it's a heterogeneous paper, purely heterogeneous paper. That's a benefit. I wanted to conduct another session on research question. Let's do that, guys. Next session should be again on research question. That is one of the toughest things for many students. But remember, the good news is you don't actually need to worry about a research question in traditional review. Your research topic is your research topic question. Easiest thing in the world to write is a traditional review, just like an essay. The only difference is you will give a reference. You write essay from your memory, but you write traditional review from by looking at other people's papers, and you give a citation. Same thing with systematic review. You write from other people's papers, but in systematic review, you explain how you collected data. That's it. And that's a mandatory part of a systematic review. Okay, so Sana has a question. What are some of the qualities, features of best systematic review your students have done? Methodology. Wonderfully done methodology. Everything was done according to Prisma checklist. And I'm so proud of my students, especially this year, the way our students have performed. Unbelievable levels. It makes me feel so satisfied that if you see the papers that have been published this year by our students, systematic reviews or even traditional reviews, they are of a whole new level. They're of a whole new level. They all wrote a wonderful methodology, everything according to Prisma checklist, Prisma guidelines. They drew Prisma flow diagram. They made sure every point was discussed in the method section and results section. They checked the duplicates, they removed duplicates, they did the screening, they did the quality check, nothing was left. Okay, so now, what according to you made them good paper? Methodology. If it's a systematic review, then the methodology. If it's a traditional review, then the conclusion. Actual method and results, everything is in the discussion section. So if it's a traditional review, then I will see your level of your discussion section. Have you written the limitation section? Have you explained everything really well? And then the conclusion, what exactly is your paper suggesting? If it's a systematic review, the first thing first I see is your method and results. I'm not concerned about anything else. I just look at the method and results. Is it really systematic? Does it make sense? Now, Dareen has a question. Is it okay to use different search strategies in different websites? Is it okay to use different search strategies in different websites in a systematic review? For example, I can use Mesh on PubMed, but exactly. This is how, Doreen, this is how you write a systematic review. You cannot do Mesh on Google Scholar. And your search strategy and keywords will be different on PubMed and different can be different on PubMed Central, can be different on PubMed, and can be different on the Web of Science. Absolutely. So remember, guys, Sana has a very valid question. So remember, if you're writing a systematic review, I want your full focus to be on method and result section and your Prisma flow diagram. If you're writing a traditional review, I want your full focus to be on discussion section. And Dareen, you are right. Yes, search strategy varies from one database to another database. Don't call them websites, call them databases. You are a scientist now, you're a researcher now, so use research language. These websites are known as databases. PubMed is a database, Medline, PubMed Central, Web of Science, Scopus, Embase, Cochrane Library, PsycInfo. All of these are all of these are websites, but we don't call them websites. We call them databases. So now Sania has a question. Can you please explain mesh? Yes, you will get the training on mesh second week. Stay patient, Sania. You will learn mesh and you will be an expert in mesh strategy. I promise. By the way, I have some videos. I'll send you the videos today. Very good, Farhana. Very good, Farhana. Database is one word. Database is one word. Okay. So now, Sania, are you feeling confident? Are you enjoying the training? Now you feel, yeah, now you're understanding everything. The real class is tomorrow or Sunday for topic selection. You will learn topic selection and research question. Then the second week is the data collection. If you're writing a systematic review, then your data collection will follow mesh strategy and all those complexities. But if it's a traditional review, it's pretty easy, straightforward. Can we do 2 or 3 papers simultaneously at the training? Absolutely. We had a student who wrote 2 papers. Well, multiple students who wrote 2 papers successfully completed together. Actually, one of the students was actually a first year medical student. And he wrote 2 first author papers at the same time and he published them successfully. Surgery student, one of my best students. He was in first year medical school. He was not even a graduate and he did it. But more than 2 becomes very, very tough. It can become difficult because you're also helping your classmates and you're getting multiple papers because of your classmates too, right? So be careful in selecting more than 2 papers at a time. 2 is more than enough for now, and then after 7 weeks when you're done, then work on 2 more if you want to do that way. Okay, anyone has any question before I leave? Guys, I have a meeting today, as I told you, so I have to prepare for the meeting. How will the authorship be in case for the second paper? Second paper is your independent paper. You are not supposed to add your classmates. That's an extra paper. You're free not to add your classmates in that. Only you can be there, and if you want to add the mentor as a second author, that's fine. Who will be the other reviewer? What do you mean reviewer? You mean author? Second author can be your teacher, the teacher you had. Ideally, until, I would say, always write with a senior until you have 10 papers. Although that's kind of trickier because I wrote a paper single-handedly with no other author involved when I only had 2 publications. My third paper was my sole paper alone. So it's up to you. If you feel confident, you can do it. Journals may have some problems, some journals, but not all the time. Okay, everyone is clear now? Guys, it's time for me to leave. If you have any question, do text me, do let me know. And I hope you guys had a wonderful session today. You guys learned something. Thank you, guys. Thank you. And we'll meet again very soon. And stay tuned for your live classes this weekend for new admissions and all the previous students. Hopefully you are already working on your papers. And if you have any question, please feel free to ask me a question, guys. I'm here. Look at this broken cell phone, answering the students' questions so many times that this is a broken cell phone for the students. You can imagine how busy this cell phone is. Please send me a message. I'm always available. Okay. Thank you, guys. See you, and best of luck for your paper, and best of luck for residency application. For 5 days left, let's do a session very soon on interview preparation. Okay. Thank you. Have a good day.